Good afternoon, everyone. Thank you for joining PHCA for today's webinar, Transition of Death Record Reporting to Electronic Reporting in the Electronic Death Registration System. I hope everyone is doing well and staying healthy during this ongoing challenge with COVID-19. We recognize the extraordinary work that you've all been doing through this crisis, and we thank you for everything that you are doing. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide the highest level of quality care possible. This webinar is being recorded and will be made available on the PHCA website under past webinars. The webinar has been approved for 1 continuing education credit for PHCA members. Credits will be uploaded to NAB within the next 2 weeks for those who have provided us with your unique NAB number, and I will be sending attendance certificates. A survey will be launched at the close of the webinar. Your feedback is important to us and our speakers, so please take a moment to complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit questions using your questions pane on the right hand of your screen, and our presenters will address them at the end of the presentation. Today's webinar will be presented by Audrey, Marrocco, Director and State Registrar, Rosie, Allison, EDRS Outreach Program Manager, and Michelle Elmquist, EDRS Outreach Coordinator, all with the Pennsylvania Department of Health, Bureau of Health Statistics, and Registries. This informational webinar is designed to familiarize our skilled nursing facility providers with the electronic death registration system, identify specific facility roles, and provide an overview of inputting data. I'll now turn the webinar over to Audrey.
Good afternoon, and thank you so much for taking time out of your busy schedule to learn more about Pennsylvania's electronic death registration system. Today we'll be giving an overview of how to use EDRS within a licensed healthcare facility to medically certify a death. So with that, just to give you a little bit of a perspective of what EDRS is, it actually began in Pennsylvania in 2016. It has actually been a national initiative for most of the last decade, and it's really an initiative to modernize the way deaths are reported to the various states and then in turn reported up to the Center for Disease Control and Prevention, which feeds into the National Death Index. So in Pennsylvania, our initiative began in 2016, and we initially focused on working with funeral homes and coroners to report deaths electronically instead of on paper. So at its simplest, EDRS is a web-based application, and it's designed to simplify that process of reporting deaths in Pennsylvania. It replaces that historical certificate of death reporting form. Next. So if you are still not certain what we're referring to, if you've been involved in completing this 8.5 by 14 inch form with certificate of death at the top, that's what we're talking about. So we're talking about moving away from this form, which there's been a version of this form out for over 100 years. Pennsylvania's program began in 1906. So it's really taking that form and pushing it into a web-based application. Next. So to help understand the simplification of this, if you've ever had to work with that really long form, that certificate of death reporting form, you had to know which piece of that form was yours to complete. And to help illustrate that, what we've done is we've taken that certificate of death reporting form and we've color coded it to the type of medical certifier or stakeholder who's responsible for completing it. And today we're specifically talking about that light green zone. That is the zone on that form, which is filled out by a medical professional in a licensed healthcare facility. Specifically today, again, talking about the nursing homes. That, you know, when a death occurs in your facility, what does your medical certifier need to know to report that death to the state? So if it's a natural death, that's when your facility would report the death. If it's non-natural or suspicious or with a few other indications, you might have to refer things to a coroner. So again, you have to know something about how to complete this form, and EDRS really simplifies that process. Next. So again, talking a little bit at that higher level again, EDRS really takes information from, once you're set up, it takes information from your user account and it presents you with those questions that are specific to your role. So if your role is to support a medical certifier, it's going to give you that segment on the paper form that's in green, and in EDRS it will only give you that medical portion. Another segment of that report of death is the personal demographics section. That's traditionally done by a funeral home. And then the death registration activity is done by our local registrars or my office. So EDRS really compartmentalizes these various segments of this reporting process to simplify it and to enable you to focus on those pieces of the workflow that are specific for your organization. Okay, so here, just to give you some perspective, like I said, we've been using rolling out EDRS since 2016, and as with many other states that were equivalent in size to Pennsylvania, it was an effort that took multiple years to roll out because death reporting can be complex. With the number of stakeholders we have, we decided to take an approach of rolling out to funeral homes and coroners and then move into the medical professionals. We've been working with various spectrums of medical professionals for the last about 2.5, 3 years to increase their adoption. And this chart here really gives a snapshot of deaths that were recorded per month during 2020 and what portion of those records were submitted in EDRS, what segment was reported on paper, and then you see that nice orange color, which is actually records that part of that record was reported on paper and part was done in EDRS. And as I mentioned on the earlier slide, EDRS does compartmentalize that reporting, so it is possible for a funeral home to use EDRS and the medical certifier to use paper. So back in March, at the onset of the pandemic, we had most funeral homes using EDRS, and we issued a state mandate that all funeral homes had to begin using EDRS unless they were granted a waiver. So you'll see that there's barely any gray left because all of those funeral homes that had been still reporting on paper have adopted. We have less than 1% of deaths still occurring on paper, and that is generally to very, very small funeral homes that don't have the technology to support electronic reporting. On the flip side, what you'll see is there's a lot more activity that's blue. So we've had much more adoption in EDRS from not only the funeral homes, but the medical side, those medical certifiers. And our goal is to continue to raise that blue bar so we have less and less of a hybrid. So it's really to get all deaths reported fully in through EDRS. So the bar will turn blue. Next. Here's just a snapshot again of what kind of the perspective was from that funeral home perspective. And again, as you can see, we had in the beginning of the year about 30% that weren't using the system. And once that mandate hit, it was a pretty quick adoption. Initially, we had about 2%, 2.5% of deaths funeral homes that were given waivers. And many of those have actually migrated since into EDRS and are no longer using the waiver that they were given back in March. So they've been able to voluntarily adopt and change their business practices and are now benefiting from some of the advantages and efficiencies that are available through EDRS. Next. So today, again, we're focused on medical certification. And we're specifically talking to, I believe, folks that are in the long-term care facility bucket. And this here pie chart just really gives you a good quick glance at how many deaths overall does that represent. And in 2020, we had record high deaths, as I'm sure everyone is probably aware. We had upward of 158,000 deaths, which is a huge jump, close to 20,000 higher than normal. And what we've seen is 26% of those deaths occurred at a long-term care facility. And in the world of death, that means nursing homes, personal care homes, and assisted living centers primarily. So our focus, again, for today is really looking at that piece of it. We have had a separate track with coroners, as well as hospitals, home deaths that are reported primarily from PCPs and hospices. So taking a deeper dive into the long-term care facilities, you can see that this area has primarily been very heavily paper-based. And part of that is simply because our focus in my organization has been working with hospitals and coroners and working with the long-term care facilities, hospices, and PCPs as needs arrived or as interest expressed. However, we are looking to get full adoption this calendar year. So we started an effort back in October to really start doing proactive outreach to your facilities to make you aware of this initiative, this national and state initiative, as well as to provide you the support that you need to successfully adopt EDRS. Next. Okay, and with that, I'm going to drop off of the call. I apologize, I'm not able to stay on for the whole training, but I'm going to hand it over to Rosie so she can talk to you about the benefits of EDRS and how this can help your organization, as well as contribute to improving the overall public health information that is necessary here in Pennsylvania and at the national level. Thank you again, and I appreciate your time and interest in EDRS.
Thank you, Audrey. So what are those benefits of EDRS? First of all, it is near-time reporting of the deaths to the Pennsylvania Department of Health, and I'm sure all of you know that that is very critical for public health purposes. It improves the quality control measures that support accurate reporting of deaths that do occur at your facility. Online case referrals can be done through the system to your funeral directors. As Audrey had mentioned, we're now over 99% of all funeral homes in Pennsylvania using the electronic system. Once you begin using the system, you will have online access to the death records that your facility has registered through EDRS. And you now will have an online and simplified request to amend a death record that you certify. The system is highly secure. Each user is assigned credentials. User credentials may be used to report deaths for multiple facilities. And when I do my demo coming up, I will show you how that works. The system is internet accessible, so it is available 24 hours a day, 7 days a week. It can be accessed on any device that's connected to the internet. It could be used on a smartphone. However, we do not recommend that. It's flexible, so it will allow a medical certifier to create the entire medical portion of the case and as well sign the death certificate in one step online. It also would allow for support staff to start the case for the medical certifier, and then the medical certifier can review what was entered and sign the death certificate later. It's efficient. It will allow medical certifiers and funeral homes to work on a case simultaneously, and there's no longer a need to track down paper forms or ink signatures. It's easy to use. It walks users through the death reporting for only those questions that apply to the user. Again, referring back to Audrey when she showed you the color-coded certificate of death. It does have built-in quality controls to reduce errors during the data entry. And again, when I do my demo, I will be showing you how that works. And we also do have online help and instruction. And again, I will point that out to you as well. This is our Department of Health EDRS website. It has very useful information and can answer many, if not all, of your questions. You'll see next to that we have our first icon. It's the EDRS sign up icon. Before submitting a user request form, the user will read the EDRS user agreement and confidentiality policy. That link will be covered under the EDRS sign up when accessed. The user accounts are available to all medical support staff and medical professionals who are responsible for reporting deaths to the Department of Health. And within that icon, there will be a link to the user request form and also directions on how to submit them when they are completed. Once that form is processed by the Department of Health, the user will receive an email that contains their username and temporary password. You'll see that we have an icon there for state registrar notices. This is our standard method of communicating important information to you as stakeholders. I recommend that you go to those state registrar notices and in particular, take a look at the ones as they apply from 2020 and relate to the COVID-19 pandemic. We also have a contact us link. EDRS support is available by phone or email on a daily basis from 7 a.m. to 7 p.m. You'll also see here that we have the statement that all deaths attributed to COVID-19 must be reported through the electronic death registration system. However, we are now encouraging you to enter all deaths that occur at your facility into that electronic system. The reason for that is that we do anticipate by the close of 2021, another mandate that all deaths must be reported electronically. On our website, you'll see we also have information broken down to the type of user. So for the medical professionals, you'll see there is a link here for EDRS quick reference sheets. They can be used for anyone who wishes to self-train. They are documents that take you through a process that is done in EDRS. They are in a PDF format so that you can print them off. And also there's a video that goes along with each quick reference sheet. We also do offer training opportunities, and there is a link that will take you to the webinars that are available. Webinars such as what I am doing today are available every Monday, Wednesday, and Friday for the medical professionals at 2 p.m. And we also offer webinars for facility account managers. We'll talk about that in a little bit. Now what I'd like to do is I'm actually going to conduct a demo for you. So what you see in front of you is our training environment. When you get your credentials, you will receive a link to the actual URL for our production site. The screen will definitely look very similar. The only thing that might change is the background that you're currently viewing. You'll see here that you will enter in your username and your password. The role that you register in EDRS is definitely specific to the work that you perform. So your physicians, nurse practitioners, and physician assistants will register as medical certifiers. These are the authorized individuals that sign the report of death. The registered nurses, medical records clerk, or any other individuals who are not authorized to sign a death report are considered administrative support, and we enroll them as medical facility users. Most often, these individuals start the case and do the entry of the pronouncement information and perhaps the place of death. Those registered as medical certifiers, again, those authorized individuals who can sign a death report, usually complete the remaining sections of the death report and then affirm and certify. You will decide what workflow suits your facility best. Sometimes we do have the medical certifiers start and finish the process. So it all depends, again, on how that will work in your facility. I am going to go ahead and log in as what we call a facility user, and I'm going to log in as a registered nurse. So you will enter in your username, and along with that, you are entering your password, and you will click the login button. This screen, as I had mentioned from the PowerPoint, this would probably occur most for any of your medical certifiers, those who can work within multiple facilities. When they fill out a user request form, they will list your facility at the top of that form. And then in block 13 of the user request form, they will list all facilities they are associated with. One username and one password will give them access to all of the facilities that they visit. So in my case, although I am a registered nurse, I am associated with 3 different facilities. So when you log in, it's important that you select the facility that you want to work within. I'm going to select Manor Care Health Services, Williamsport South for my demo. And now you will see I come to my home page. At the very top of the screen, you will see the facility name listed. To the right, you have your user ID next to the logout button. You have a series of menu options across the top of the screen. These menu options will follow you throughout when you're working within EDRS. The main option will provide you, you can click to go on home, which is where I currently am. If you do have assignments or credentials to work at multiple facilities, you will have the ability to change office. So you could be in signing a death record or completing a death record for one office, and then you could change to work within another office that you're associated with. The only caveat to that would be when you change office for security purposes, you will be asked to log in again. You can change your password. You'll see that you have messages. Messages will be related to the role that you play within the EDRS system. You have current activities, also known as queues. Again, queues will be applicable to the role that you are playing. And then you also have your log out button. You have life events with a submenu for death to locate a case or start and edit a new case. You have your queues, registration work queues, and a work queue summary. If I were logged in as a medical certifier, again, someone authorized to sign the death record, I would have another queue available to me, and that would be for amendments. Only an individual who can sign a death record can perform an amendment. I'm going to bypass forms. You have the ability to print forms within the death record. Here is your help. This is showing you that you have a medical certifier user guide. Basically, this is a composite of all of our quick reference sheets that I referenced that are available in the Department of Health EDRS website. Below, you'll see that we have a series of fast links. As you come into the system, you may have 1 or 2 fast links already available, but as you begin to use the menu options above, you will see that the system will automatically give you a fast link so you can get into that area quickly with just 1 click. If we look at our messages, again, you saw that messages were available from your main menu. Again, messages are going to be available to you based on the role that you play. You will always see who the message is from. You'll have your subject. Most often there will be a link that takes you to the decedent's death record. As you work with these, you can actually remove them from your list. You can do that one at a time by clicking the checkbox and doing the remove from list, or by selecting the checkbox at the top, you can remove all of them. You also have the ability, as you get staff registered within your facility, to send messages back and forth to each other. We have our death locate case button. The death locate case is always used when you have a case that you've already started or worked on, or if a case was worked on someone else at your facility, you can locate the case by using this option. Your Death Start Edit New Case option is for starting a brand new case, or if the funeral home started the case, you can use this quick, fast link to take ownership because the case has not yet been claimed by your facility. Again, you do have your work queues, and they will display cases that are not fully finished or valid and need to be affirmed. I am going to go ahead and show you a demo of creating a brand new case. So you would start a brand new case by clicking on this Death Start Edit New Case fast link. It will take you to the Death Start Edit New Case screen. Anything with the red triangle or a box that's encased in red are required fields. So you'll see here, you're going to be entering the first and last name of the decedent, a date of death, as well as the gender. Your date of death, you do see that there is a calendar icon to the right that you can use to select the date of death, or if you choose, you can enter in 2 digits for the month, 2 digits for the day, and 4 digits for the year. And when you tab out of that field, it will go into the format used by the electronic system. The last required field is for your gender. Choices are female, male, and unknown. Once you have everything entered, you will click your search button. This will be your death search results screen. What I see here now is what I hope to see when I start a new case. It's telling me there are no cases that matched the criteria that I entered. That means that I'm good to start a new case for this decedent. Should you come back with a match with the decedent's name, you would not want to start a new case. If you did so, it would actually create a duplicate case. And in the system, you can't delete cases. We can abandon, but it still will create a new case. So at this point, you're going to click your Start New Case button. And now you are going to be brought into the decedent's death record. Again, your facility name at the top, our main options, our menu options have followed over. We have a number up here that we call our unique ID number that was created by the system. In our training environment, it's 5 digits long. When you go into production, you'll see that it is an 8-digit number. Our name, as we entered it for the decedent on the search screen displays, along with the date of death that we entered. Below, you'll see this statement where now it's reading new event, and so forth. We refer to that as our status bar. I like to say that it provides you with a lifeline of what is going on with the decedent's death record. As we go through the demo, I'm going to point out how that status bar can change. You'll notice that we are on the decedent screen. It's highlighted here as well underneath the death registration menu. You have your personal information, and you see that the decedent is highlighted as well. The information that you entered on the search screen is there for you. If you did have a middle name, you could enter it. If you realize that you misspelled the decedent's name, you could make that change as well. As you come down to see Social Security number, date of birth, and so forth, all of those fields are grayed out. That's because those are the responsibility of the funeral home. You have a series of buttons across the bottom of the page. The validate page button, I will show you at the very end of my presentation for this demo as this user. This is what will trigger rules and regulations behind the scenes. Did I enter information correctly? Did I forget any required fields? The next button will allow you to enter your information on a screen. Clicking next will save the information and take you to the next screen in the process. You have your clear button. If I would clear, it would give me a message that I'm going to clear all of the information that I have entered on the screen. The save button, I can enter information on the screen and use the save button. It will keep me on the same screen that I've been working on. And return will simply take you back to where you started from. You'll notice in the death registration menu, you do have the medical certification information and the different screens that will be available to you as we go through this process. Everything that you enter is going to be the exact information that you enter on the paper certificate of death. I have completed entering the information on the decedent screen, so I'm going to click the next button to save what I have entered, and automatically now it will take me to the medical certification section, and I am on the pronouncement screen. Notice that the middle name that I did enter for our decedent now appears at the top of the screen. Our date of death has populated for us. So now I'm going to select the only option available for the date of death modifier, and that is the actual date of death. You are going to enter in a time of death. The options you have here are AM, PM, or military. Next, you have your time of death modifiers with 3 choices of actual time of death, approximate time of death, and pronounced time of death. The date pronounced dead and the time pronounced dead are not required fields. If you do have that information, they would be entered there. On the pronouncer name information, I am in as a registered nurse. For that reason, I have to manually enter in my information. So I would start off with my license number, and usually that is going to be 2 alpha characters followed by 6 digits and sometimes an alpha character on the end. They would enter in the information for their first and last name. And you'll see that we do have a drop down for title. So depending on who is completing this screen, they would select that correct title. Again, I'm a registered nurse, so I'm going to select RN. And next you would put in the date that you signed for the pronouncement. And again, you could enter in the information manually or use the calendar icon. Now, as a registered nurse, you might be completing this screen, again, based on how you want to set up the workflow in your facility. It could also be completed by a medical records clerk, or again, this could be the medical certifier doing the case start to finish. I'm going to go ahead and click the next button. You'll now see it's taken me to the place of death screen. The only thing you have to complete on this screen is the type of place of death. So for our webinar today, we would be working with the nursing home long-term care facility. All of the information that you see populated is a result of how I signed into the EDRS system. Again, this might be a screen that's being completed by the registered nurse or a medical records clerk, or again, it could be completed by the medical certifier. I'm going to go ahead and click the next button. We do come to the cause of death screen. This would be a screen that would be the responsibility of anyone that can certify the death record. You'll notice that we do have a link here for recommendations on how to enter the information on this screen. You will only use 1 line for each cause. For every cause, you will put in an approximate interval for the onset to death. That can be anything from seconds to years. Or if you're not unsure of the approximate interval, the system will accept unknown. You will enter in the chain of events. We do not want you entering in terminal events without etiology. and we do not want you to abbreviate. You'll have part 1 with different lines A through D, and you also have part 2 where you can enter in other significant conditions. I'm going to enter in a cause that might be something you see quite frequently with the pandemic, and I'm going to put in acute respiratory distress syndrome. Notice you do have a spell check available, and I'm going to enter in 2 days as my interval. I'm going to say that that respiratory distress syndrome was caused to the decedent having pneumonia. Again, I'm going to enter in 10 days. And then I am going to say that that was due to COVID-19. I'm going to purposely leave that field blank so I can show you how, when I validate, an error will be triggered. In part 2, you could be putting anything like high blood pressure. You could be putting in diabetes mellitus. You could be putting COPD, anything else that would be leading up to that immediate cause of death. I'm going to click next to save my information. I now come to my other factors. Again, a screen that would be completed by a medical certifier. Was an autopsy performed? Yes or no? If I would select yes, then the question below would have to be completed. If the decedent is female, you'll see it's going to ask if that decedent was pregnant within the last year. Because I'm creating a record for a male, it is grayed out and has not applicable listed for me. Did tobacco use contribute to death? Yes, no, probably, or unknown. For manner of death, you have one choice, and that would be natural. The last question you see on this screen, was the medical examiner or coroner contacted? This question often causes a lot of confusion, especially now during these times with the COVID-19 pandemic. So I'm going to give you a little bit of a longer description of what this field is meant. For the medical professional, if they feel the death was due to an unnatural or suspicious cause, they would enter yes. Then they would be actually referring it to the coroner to review this death record for medical certification purposes. If that's the case, the medical professional should wait to hear back from the coroner before proceeding with the certification of the death. If the coroner deems that it is of suspicious or unnatural causes, they will take the referral and they will be the one signing off on the medical certification. We don't want you to confuse the question with contacting the coroner for notification of a death. A good example of that is, again, with COVID. A lot of our coroners in your counties are asking that you notify them of a COVID-19 death. Notifying them is different than having them certify the death record. So in that case, your answer to this would be no. I do have a COVID-19 related death. I did notify my coroner, but I'm not referring it to them to certify the death, so my selection would be no. Again, I'm going to save my information and move to the next screen. And this is our certifier screen. I am logged in, again, as a medical facility user, so I would stop at this certifier screen. If I were doing all the entry for the certifier, I could ignore this screen and not put anything in it. And when the medical certifier comes in to certify the death record, based on their login information, all of this data would pre-populate for me. You do have the certifier type, so you would select the correct option. Others, it would either be the certifying physician or it could be a pronouncing and certifying physician. Anyone that wanted to complete this form has multiple ways of doing it. If you do know the license number for your medical certifier, you can enter it here and click on our auto-populate icon, and you'll see that all the information comes back for us for this screen. The other option would be, I'm going to use our edit icon, which is a little pencil, and clear my data. I could also use the magnifying glass. The magnifying glass in our system allows us to search. One required field, I'm going to put in a couple letters of my certifier's last name, along with the percentage sign. The percentage sign in EDRS is a wild card. I'm going to search. The system is going to bring me back any certifier that started with VA. When I find my certifier, selecting the select link will again populate that information for me. Notice on this screen, the date signed is grayed out, and there will not be completed until this death record has actually been affirmed and certified by the medical certifier. Right now, our status bar has remained the same. I've entered in all of the required information for all screens. At this point, I want to validate that everything that I have entered is accurate. You'll notice now at the top, my status bar has changed. It is personal and valid because the funeral home has not yet taken ownership to do any of the personal information. And right now it is telling me that it's medically invalid. So if I look at my death registration menu, you'll see now some little icons. You'll see a green check mark. We refer to this information as a stoplight. If you have a green check before the screen name, that means everything is good. You're good to go. Sometimes you would have a yellow circle, and that would mean caution. The system wants you to review what you've entered. If what you entered is exactly as you'd like it in the system, you can override that error. When you see a red X, like you see for my cause of death screen, that means stop. The system is not going to let you proceed with the case until that error is corrected. So I would just click on that screen name, and you'll notice now that what is missing is highlighted in red. As well, I have a message at the bottom of the screen. So it is telling me that my interval for line C cannot be left blank. So I would have to correct that error. And then what I would want to do is validate again to make sure what I entered is okay. And once again, you'll see now everything is good to go. We have all green checks, and my status bar now reads medical valid. The last thing I'm going to show you right now for the facility user is that you can actually request medical certification. So if you are the medical user coming in to do, say, the pronouncement and the place of death, you could do that, validate the information, and then send it on its way for that medical certifier. To do that, there are 2 required fields. You would have to know who that certifier is going to be. Again, you're going to search, and you can use the wildcard symbol of the percentage sign. When you do your search, you're going to go ahead and select. And now my name for Charles Baker, my physician's name, has come back for me. Now I have to find the facility that he is associated to, and you search based on the facility name. I'm going to enter part of the facility name with my wildcard, perform a search. Notice that there's 3 results because this physician is associated to multiple facilities. You would want to make sure that you do select the correct facility, the one where this decedent death took place, and that information then comes back as well. A message automatically populates telling the certifier to complete the medical certification. It gives the case ID, the decedent's name, and the date of death. You can also, this is like a free text form, so you could erase everything you see here, put in your own message, or you could add on to this message. Once you click save, the status bar is going to change. I'll point that out. And also, it's going to trigger a message within EDRS to this medical certifier, letting them know that they have a case to complete. It will also trigger an email to the email address that the certifier put on their EDRS profile when they registered for the system. So I'm going to go ahead and click save. And now again, when you look at your status bar, it says medical certification requested. I'm going to go ahead, I'm going to log out, and now I'm going to come in as that doctor for the nursing home and enter my username and password. I'm going to select the office that I want to work within. I'm going to go to my messages. You'll see here now that my message from that medical certification for our decedent has carried over for me. So all the certifier would have to do is click on that decedent's name. Now we know that all of the information was entered by a facility user. A lot of times it might only be the pronouncement and the place of death. But for purposes of the demo, I entered all of the information as facility staff. It would still be the responsibility of the certifier to go through all of the information and make sure it was entered correctly. They can do that by reviewing the screen and clicking the next button to take them through all of the entered information. If they saw anything that they might need to change, they could make that change during the course of review. Everything is pre-populated here. Again, the date signed is grayed out and does not have a date within it. At this point, they would want to validate all the information that they might have entered or changed. You'll see here that we have all green check marks. That means that everything is good to go. And now a new link that we didn't see as the facility user appears. This is the certified link. So the medical certifier would click on that link, and this is where they would affirm that to the best of their knowledge that true and correct information regarding the decedent has been entered. They would select the checkbox and they would affirm. Again, once they affirm, the status bar is going to change to show us now that this case has been certified. So that concludes my presentation for today. And I'm going to show you one last screen here. Again, we do have a hotline that is available to you. We have an 800 number, and we also have an email address where you can contact us, again, 7 days a week from 7 a.m. to 7 p.m. A lot of the information for links to our website and this information for the hotline will be provided to you after this presentation is over. So I'd like to turn back now to Wendy to see if you have any questions for Michelle and I.
Thank you, Rosie. That was great information that you shared with us today. We are opening up for question and answers right now. We do have several questions that have already come in, so please feel free to type those questions in the questions pane on the right hand of your screen, and we'll get started. We still have a couple minutes, so hopefully we can get to all of the questions. The first question is, as an RN, once the certificate is completed with initial information and we are ready to release the body to the funeral home, do we just tell them that the certificate is online? And also, do they need a reference number?
That's a very good question. First of all, when you start to use the system, communication with your funeral homes is very important. Normally, they would come to your facility and pick up the piece of paper with the pronouncement information and the body and get the information from the certifier. Now that you will be starting the case and entering that information into the system, you definitely want them to know that you are completing the death record online. What you will do is you will provide them with the exact information that you entered for that decedent on the search screen. So the exact first and last name, date of death, and gender. If you find out from the funeral home that you entered it incorrectly, they still must enter it as you entered it into the system to be able to bring that case up and take ownership of it. You do not need any kind of a reference number. If you have the case ID, you could give that to the funeral home.
Great. Again, a couple more questions coming in here. How do we unenroll employees who may have left the facility?
That's another good question. What I will mention is if you are going to have more than 10 users at your facility, we definitely recommend that you put them in the role of facility account manager. That person will be able to enroll new users, inactivate users that leave your facility. They can reset passwords and basically do everything that could be done by the Department of Health. So you are eliminating that middleman and having that ability to do it from your facility.
Okay, next question. Does the RN have to place the cause of death, or can that be left for the physician?
That definitely can be left for the physician. Again, depending on the flow at your facility, most often the registered nurse or medical records clerk would be entering in pronouncement and place of death.
Okay, here's another question. If a physician or funeral home is not using the system, do they then use the paper form?
Yes, key to using the electronic system is having a medical certifier registered and using the system as well. If your facility contracts a physician or physicians, then you should simply let them know that it is a mandate that all COVID-related deaths be entered into the system. And for you to meet that mandate, they should register to be able to perform the certification of the death for your facility. We encourage everyone, all physicians, to use the system. You would maybe at least have on staff a medical director who you would want to register and at least certify deaths that the medical director might be responsible for at your facility.
And that is free of charge to register, correct, Rosie?
That's correct. It is free of charge.
Government system. And how long would you say it takes to get the information in there to register?
To register, it's a very easy process. You would go to our website and there is a link that will take you to the user request form that you can actually print off and complete and submit that into the Department of Health. How you submit is listed right on that user request form. The turnaround for getting credentials is very quick, usually 1 to 2 days, and then an email is triggered to the user, providing them with their username and temporary password and a link to the production system.
Great. And you will be sending me the link. I'll have the link to send out in a follow-up email to this webinar, correct?
That is correct.
So that folks can just click on that and take care of what they need to get registered from that link that I'll be sending.
Right. And I do also want to mention on the question that was asked about the physicians, you can encourage them, even if they are not contracted to your facility, to begin using the system. Again, we believe that by the end of 2021, it will be a mandate for all deaths, all parties to be entered into the electronic system.
All right. That was our last question. If anybody does have any more questions, please feel free to type them into the question box. We still have just a couple minutes here left in our webinar day, our hour. There's a lot of information, but it looks really user-friendly to me.
It is a very user-friendly system, and again, you do have the validate function, so any information that you might have entered wrong or forgot to enter, it will trigger off that message to you to be completed. I also want to mention for the facility account manager role, there are webinars available on Tuesdays for that role as well, or it can be self-trained by using the quick reference sheets that are located on our website.
Great. All right, so we're getting a couple more questions here.
Okay.
As RNs, do we need to complete the certifier section or leave that to the certifier?
You can leave that to the certifier. Again, once they log into the system to complete their information, that page will pre-populate with all of the information, and all they would have to do is select what type of certifier they are.
Okay. Here's another question. Are there alerts to make sure certification gets completed and ensuring a follow-up?
That would go into your queues. So you would check your queues on a daily basis, and anything that is still pending, it will sit in one of those queues. It will tell you how many days it has been sitting there. You can either use the request certification again if you're notifying a certifier, or set up your own method within your facility as to whether you want to make a phone call or use an outside email to that certifier to ensure that the death record has been completed. Most often, if it goes for any length of time, you will hear from the funeral homes, because again, 99% of them are registered and using the system. And if they know you started using the system as well, they're going to be asking you if that information is complete.
Okay, we have a couple more questions here. Can death certificates be printed out once complete or verified?
Yes, you will have the ability under other links. That was the section I went to for the request medical certification. And you will see that there is a print forms selection. They will click on that and have the ability to print out a working copy that will contain all of the entered information, and it can be printed and placed in the medical records file.
Terrific. Two more questions. Again, if you have any questions, please type them in, and we'll be sure to get those answered for you. Next question is, can the registration link be forwarded to other nurses in the facility and doctors to click on for them to register? I would think that would be a yes. You can forward the link.
The user, for them to register into the system, I'm trying to understand the question, everyone would have to complete the user request form. So that form can be given out by the facility to anyone they want to register. And everyone would complete their own user request form, and everyone must have a unique email address that is going to register. Does that answer the question?
Just to add to that, the link to the user request form can be shared with anyone who needs an account, as well as the EDRS website. If anybody needs more information on that, that can also be shared with any, of your colleagues or anybody else that you're going to be working with that needs to have that information.
Thanks, Michelle.
Great. Yeah, thanks for clarifying. Here's another question. Can you have more than one facility account manager?
Yes, you can have as many as you think your facility would need. Definitely for 10 or more users, you would want to have one. If you would like to have a backup, which would be a great option, you can have more than one of that, one of those individuals in that specific role.
All right, and we have one more question. Again, if we're at our time, but if you do have questions and want to, stay on, we still have a number of people on. So this is really good information as it's new and rolling out. It's important. So if anybody has any questions, please type them in. The last question that I have right now in the question box is, how do you link a physician who might be logged at multiple other organizations?
When they would complete a user request form initially, they would be listing your facility name at the top of the user request form. There is a block on that user request form to be used by medical certifiers to list any other facilities that they are associated with. When their account gets created, every facility will be entered for their profile, and they will receive one username and a temporary password, but they will have one username and password for all of those facilities that they are associated to on their profile.
And if at a later time they need to add an additional facility, or if that doctor already has an account, they can just request, send in the user account form, or if you get a facility account manager, you can just add your facility to their profile. Or they could send in the user account form, and in section 13 saying basically just word, I have an account, need to add this facility, and put the name of the facility they need to add to be able to have access to.
Great. All right, well, that was the end of our questions. So I just want to take a moment to thank Rosie and Michelle for the information shared today. It was a lot of information, a lot of good information. I'll be sure to send out the follow-up email either later today or tomorrow, so look for it. And if there's anybody that you want to share the link or information, the webinar is being recorded and will be made available on the PHCA website under past webinars. So if there's anyone that can benefit from listening to and viewing the webinar, please feel free to share that information. Again, we're going to wrap up. Please stay on to complete the survey. Today's webinar, like I said, is being recorded. And be sure to check out some of our other webinars coming up. We have one later this week on staffing, which is always of interest and concern in the industry. So we have that coming up on Thursday at 2. If you've not already signed up for it, check it out on our website. And again, I want to thank our presenters for today's demonstration, and just wish everybody to have a good remainder to your day and your week. Stay well.